Hi, this is Angela Bavaro, and I am your Nursing 120 instructor. I would like to go over um, teaching philosophies. Um, in section 1, I will be talking about how I will become, um, how I will help students to become more self-directed and self-regulated as learners. So I like to present an outline material of the material that we're going to be covering that needs to be achieved for the day, for the semester, and then for the week, and then we break it down to each day. Everything is divided into learning per week that we are responsible for. So providing various learning tools to aid in this mastery is one way that I can give you options. I want you to look at the tools that are provided, and I will go over some of those in detail. And then you find what works best for you. Providing testing intervals with remediation to keep you on track is my job. So I am making sure that you are getting the material and you feel confident in what you're learning. I don't normally set due dates for assignments, putting the responsibility on you. So I let you know that you need to cover this material, it needs to be absorbed. So you need to fashion your study life and your school responsibilities as such. That way your success and or need for any remediation is something that you understand how much you put into it is what you are going to be getting back. For your student experience in section 2, I would like to discuss sharing your past experiences with medical issues personally, both, and then for any family members, friends, people that you might have been a participating caregiver, and just letting you know that often those are times that we feel or learn about ourselves that we have passion for caregiving. We see people's lives change. These are not when people are at their best, when they're ill. So providing care and both mentally and physically, helping them with nursing them back to health, or perhaps maybe at the end of life, helping that transition happen is something that happened in your life. So I encourage you to speak about that. And that way it makes it more real and it helps you to learn what you're doing all this for. What are your talents? Like, what are you good at? Are you good at being personable, friendly? Are you very stoic? Let's find what your strengths are and make them into a healthcare profession in the professional setting, something that you can list as part of your skills. So we might need to focus on that and help you. And there might be skills that you didn't even know that you had that would help you, but would benefit you in nursing. First and foremost, always with everything that we share, it's obviously personal and sometimes painful stories that we have that we went through. It can be for going through a healthcare or health crisis, maybe mental health. So we always want to provide a non-judgmental environment in this classroom because you need to carry that over into your nurse practice. You need to be a non-judgmental nurse, and you're going to get patients to trust you more and feel that you're someone to confide in if you're able to let them know that you're just there to listen to them, validate them, and help them. Section 3, technology. We do utilize several parts of technology. Utilizing YouTube videos, we have ATI, which is a learning platform for preparing you for your NCLEX state exam. We use Picmonic, which is another learning platform that is used to help memorize and learn medical concepts, terminology, lab values. Nursing.com is another learning platform, and it has great videos on simulation. It's got lectures outlined. It has concept maps, skill sheets. There's lots and lots of content in there that can help you in your theory class and in 121 your nursing clinical. I have you do videos of yourself, and then you can use these to share one for a learning tool for yourself, and then also for the class. And so this shows a variety of nursing care applications. Flip the classroom, you're going to be teaching a topic. So I give lots of practice with that to help strengthen your confidence in public speaking to nurses, because 90% of what we do is education. And PowerPoint development, so making PowerPoints, presenting materials to your class. This helps you, again, in preparing for how you're going to do patient teaching on, say, providing insulin for a patient for themselves to be taking a blood sugar and then having to give themselves insulin. So you need to have those abilities and feel comfortable. Our school does make available laptop rentals. So there should be no, if you don't have, laptops are required, or a tablet in class. If you don't have one personally, we provide those here at our college. Section 4, promoting self-directed learning. After determining what styles and tools benefit you the most, I have you teach back. So in class, like I had explained previously, we use the flip the classroom. We use video demonstrations of certain skills, like a head to toe assessment. And this is going to prepare you. It gets you creatively thinking, because you have to critically think. And so a lot of that is being creative. Offering ATI and Canvas exams are how I can see how you're doing. And it gives us a chance to do some remediation where we need to. Section 5, teachers and students resources. So I like to make sure that if you are not absorbing, you need to change something. So sometimes we got to take a 5-minute like meditation break. So we will do that, or a sunshine break. We can go outside, take a little, just stand on the deck there, get some sunshine, maybe walk around the quad and have a exercise moment to maybe wake up your brain. Sometimes the material can be long and laborious. So if you're having anxiety about doing a presentation, if you're just having fatigue, take one of those opportunities to refresh your brain. Extended opportunities, we have EOPS. It's an extended opportunity program and services. It's a state-funded service-oriented program. It combines financial assistance with support services designated to inform, recruit, admit, and academically motivate low-income and educational disadvantaged full-time students. This is to help you pursue your college education. So EOPS offers multiple services and resources. So I would encourage you to check out the EOPS department. As well, we have the DSPS, which is the Disabled Student Program and Services. And they're about equality for students, making sure that any student can reach their full potential. And if they have disabilities such as anxiety, that's a mental health issue. If you have any issues with learning abilities such as dyslexia requiring longer testing time, anything that you might need, DSPS will help you to get tested, help you to with any aids that are available, and maybe special tutoring, extended tested time, proctoring. They have special tutoring, transcript services so that you can hear instead of having to write notes. They're hearing impaired. We have translators that translate in ASL, and also providing at-home case studies for student learning is another option that can help with your resources. These are true to life cases, so they're going to give you opportunity to see how you as a nurse will fulfill your role, what part of those duties might you need to strengthen, and then we use the various resources that I gave you to work on them and to strengthen them. Thank you so much.